The team of health officials who form the East Central and Southern Africa Health Community EXA sought to, among other things, answer the question of the continuing shortages and poor retention of skilled health workers, especially in the rural and remote areas of the member states. In spite of commitments to which states append signatures, health workers continue to be overworked and poorly remunerated, which is a setback to effective healthcare services.
The issue of human resources, especially motivation to work, is an area the ministers have discussed even in the past. What is it which can keep health workers giving good services? In as much as money is important, but there are still also other non-monetary motivations. And these are issues like being able to further your education.
After 3 days discussing at the 6th Regional Forum on Best Practices in Arusha, Tanzania, health officials called on member states to respect health workers. They recommend that states forge practical solutions to the health workers' crisis in the region.
To have health workers who are happy at work, not just because of money, but because the environment in which they are working is improved. Having the right equipment. If you are a doctor and you cannot perform an operation which you've been trained for, that demotivates you and makes you leave the service.
To complicate the debate even further, the delegates want governments to implement high-impact interventions to reduce maternal and child health, whose toll has increased in the recent past.
We are therefore recommending that member states review and/or consolidate approaches to health financing that favor equitable allocation of human and financial resources to frontline health services for women and children.
Still others prefer interventions to reduce stunting and for governments to invest more in diagnostic laboratory services that should be linked to functional health systems. Regional health technocrats are hopeful that improvement in healthcare provision in the East, Central and Southern African states is still attainable. They cite the need to increase innovative interventions that can ease work processes for the few health workers in the region, as well as investing in diagnostic laboratory services. Walugembe, UBC News, Arusha, Tanzania.